My name is Dr. Ian Lewis. I'm Associate Director of Research for the Welsh cancer charity called Tenovus.
What problems do you experience receiving applications for funding from arts and health researchers?
I think in the first instance it's just letting arts practitioners know really that we're out there and we're willing to receive applications from them. I think that there's a huge opportunity using the arts to support the huge number of people who are not just affected by the disease but also the fallout of the disease longer term. And really it's about encouraging artists to think about how they can use that in a way that will ultimately benefit things like the health and well-being of those participants and also the wider community. So that's the first challenge really, is get people to know we're out there and to have the confidence to apply. I think following that then there's certainly a lot more support needed around just showing them the language and teaching them the language that they need to fill out an application in to get that funding and secure that funding, because with the best will in the world it's incredibly competitive now and they're up against a huge number of people looking for funding at a time when research spend is sadly shrinking. And then the third challenge really is about finding the best people to provide them with the expertise to ensure that not only is the application itself successful, but ultimately that the project itself is successful and they haven't missed opportunities, they're using the right tools and methodology, and ultimately ensuring that they prove that their intervention is effective.
What I'm hearing from you is the need for collaboration.
Yeah, absolutely. It's very rare, or it would be very rare, I think, for maybe an arts practitioner, certainly someone who's excelled in the field of the arts, to also have a research background. There are charmed individuals like that out there, but obviously some people are first and foremost artists or work with communities rather than in the research world. Conversely, there's a huge wealth of researchers out there who maybe haven't worked in arts and health specifically, but have all the tools and the skills to help ensure that arts-based health research can be effectively evaluated. So really it's about marrying those two worlds together for the benefit of both sides.
And how can patients help?
I think patients play an absolutely crucial role in all of this. In the first instance, identifying and highlighting their own needs to funders, and funders really need to do more to acknowledge those needs and actually listen to the patient voice. I think that in the design of the studies themselves, I think that the patients have a huge role to make sure that those studies are feasible and appropriate. And then not just in the actual doing of the project as well, but also in the dissemination of the project at the end as well. And I think it's, as with all research really, I think that the patient voice can only ensure that the research we carry out is excellent, but also appropriate to their needs.